Today's episode is a highly contested and controversial topic that I do believe requires some nuances to get a better understanding. We're going to be answering the question, will losing weight help my sciatica pain? And the reason I'm doing this episode is because a lot of patients come to me telling me that their doctor has informed them that if they lost just 20 to 30 pounds, that their pain will go away. But by the time they're actually coming to speak with me, they've already lost those 20 to 30 pounds, but they're still in a lot of pain. And so questions arise. Was it just a cop-out? Were the doctors lying to them? Or are there other factors at play? So today I'm actually going to be dispelling the myth of whether or not losing weight is going to help with sciatica pain. And we'll be breaking the episode down into a few sections. Number one, just debunking the myth of body weight and its relationship to pain. Number two, we'll also talk about how actually increased body weight can affect our posture, how inactivity can actually lead to more pain. And then ultimately, we're going to go over some specific strategies to help you overcome your sciatica pain regardless of body weight. And this episode actually comes at a perfect time, being that it is the new year and many people are making a resolution to lose weight. So let's get started.
This is the Fix Your Sciatica podcast.
Here we are at the start of 2025. Many people, such as listeners like you, have made it a goal this year to focus on your health. Get back to working out, doubling down on eating healthier, or even trying to find ways to improve your productivity without having to rely on so much caffeine and coffee. Now, last year, my wife gave birth to our beautiful baby girl. One thing that I was concerned with going into fatherhood was how was I going to function with the lack of sleep? Do I just drink more coffee? Luckily, I came across Magic Mind, which is an amazing focus shot, not an energy shot, but a focus shot whenever I was running low on energy and attention. And as a result, I only had to have 1 cup of coffee a day and I was never over caffeinated and my sleep was not affected as well, aside from the fact that I had a new baby. And so over the past 6 months, I've been tracking my sleep and my health via my Oura Ring, and I've noticed actually a huge improvement in my daily stress as well as my sleep quality. Magic Mind actually just came out with their 24 pack, which includes both a focus shot and a sleep shot, and at a 45% discount. And you can actually check it out if you're looking to improve your mental clarity. We call it mental wealth, without over caffeinating and drinking too much coffee. The link to the promotion is actually going to be found into the show notes. So when it comes to losing weight or treat sciatica pain, we actually need to determine the difference between body weight and body composition. Body weight is actually the sheer amount that your body truly weighs. Now, what does that include? It includes your bone. It also includes your skin, it includes your muscle, but it also includes your fat. And the big limiting factor about weight, specifically how it's calculated in relation to your height, is through your body mass index, which is called your BMI. And the problem with that is the fact that you can have two people of equally normal height. So 2 people at 5'10", they can weigh the same amount, but person A has a lot more muscle than person B. And what that means is that although their BMIs are the same, their body and their health can actually be quite different. Another thing is the fact that what's really hard about it is that we need to be able to differentiate between fat and muscle, because fat is going to be one of the more inert tissues. Now, we have 2 different types of fat. We have brown fat, which is going to be the fat that we need. We call it the essential fat. That's something where we need to ensure that we have enough brown fat to allow us to produce proper hormones, temperature regulation, and also energy. The yellow fat, what a lot of people consider when it comes to belly fat, is going to be the adipose tissue, which is going to be the yellow fat. And that is going to be primarily body temperature, yes, and also energy, but that is the stuff that we accumulate when we either eat too much food or if we don't burn enough calories. And there's certainly some other nuances to that as well, but I just had to clarify the difference between the two. Now, a much more valuable piece of information that we want to look at is not necessarily body weight, but what we call body composition. And that is going to be determining how much muscle compared to fat you have in your body. And the reason why I say that's important is because muscle are functional units in the body. We use muscle to generate force, to stabilize, and to actually just create movement. Oftentimes fat is really just more so there to keep us warm, but the great thing is that we live in climate controlled areas for the majority of the time, which gives us the opportunity to really focus on trying to develop that muscle. And what that means is that the more muscle, the higher potential you have to create stability and to protect yourself from pain. But the big question is trying to figure out that when it comes to having weight or trying to lose weight is under the implied myth that having more body weight is actually going to be creating a lot more stress and further degenerate your spine. Now, if you look at your body, what's interesting is that there is really no research that actually supports this claim that more body weight will actually irritate your discs more. In fact, the research has shown quite the contrary, that there is no association with that. And I'm actually going to be putting the link to that show in the show notes just so that for your reference. But if we look at it, that idea, increased body weight accelerates degeneration, is a little bit more true in regards to our feet, our knees, our ankles, and our hips, because those are the joints that are actually supporting the majority of the weight. If we're looking at the spine itself, it sits right in the middle of the body. So it's really more so supporting the weight of the upper body, which is not as heavy as the rest of the human body. So the likelihood that there's going to be a lot of compression force because of our body weight is highly unlikely. However, there are some cases where increased body weight, primarily increased belly fat or having a larger abdomen, can result in the shift of our center of gravity, also known as our center of mass. So if you have a larger abdomen, what can happen is that the weight will pull you forward. Now, in order for you not to fall down, most people will have to arch their back to remain a little bit more upright. So we go into what is called a hyperlordosis, or a slightly extended spine. And we've identified that although an extension or flexion or rotation, any of these motions is not particularly bad for the back, when we have excessive motion or excessive motion with a little bit of additional load, can increase the risk of some possible irritation. And so if we're looking at the forward shift of our center of gravity, facilitating a little bit more of that extension-based motion in the back, we can run into a couple different issues, which includes spondylosis, which is in fact going to be an irritation, not of the disc, but just overall of the back itself. And one condition, which is what is called spondylolisthesis, where we're having the forward slippage. And usually that forward slippage of the vertebrae is going to be a result of a lot of forces posterior, so pulling everything to extension, and not enough support anterior, which would then allow that vertebrae to slide forward. Now again, the reality is the fact that it can be somewhat associated when it comes to pain, but it's not necessarily a death sentence, because there are plenty of folks who actually have an anterior pelvic tilt or an increased lordosis in their low back, and as a result have no pain whatsoever. So we have to keep in mind that it can put you in positions, but it's not necessarily going to be putting you in those positions that will cause your pain. The other instance in which having the center of gravity shift forward that can be challenging or a little bit more irritating is the fact that your glutes have to either contract really, really hard, or they have to release as a way to support yourself. And so what ends up happening, the butt muscle, specifically the piriformis, can get irritated, and you can either end up with either a shortened piriformis, which means that the piriformis is really tight, and when a muscle is really tight, it can actually press on the nerve and cause irritation specifically in that area. The other scenario is when the piriformis gets stretched out. Now, the sciatic nerve runs right underneath the piriformis, or in some cases, depending on your anatomy, might run through the piriformis. And again, when you have a muscle that is extremely tight or is extremely lengthened, one of the big things that happens is that we can have a possible irritation of the sciatic nerve. And so it's important that we actually focus on hip stabilization to prevent that from happening. And so from there, it is important for us to figure out, is the pain coming from our back or is it coming from our, because it gives us an opportunity to figure out, are we looking in the right position? And so The last reason is of how body weight can actually influence the mechanics of our body or how we move is actually how it can affect how we walk. And so in some cases with higher body fat percentages, you might have thicker thighs, which in essence, if you don't like your thighs rubbing, you're going to walk with your feet a little bit wider, your thighs a little bit more spread. And in order for you not to fall over, you're going to have to turn your feet out to maintain that balance, which in essence creates a little bit more of an instability, resulting in a little bit more work happening at the hips. And it's something that we need to consider. Now, walking with a toed out gait is not a bad thing, but in some cases, if you're noticing that you're having a lot of pain, you're doing all these stretches and you're not really getting any sort of relief, another opportunity for us to make some changes is actually on how we walk. And so we're looking at, are we moving enough at the hips? Are we minimizing motion at the spine? Are our glutes contracting too much? In some cases, having a higher body weight or specifically higher body fat can be a result of inactivity. And so we as a society in modern times, we're all in fact a sedentary group compared to our pre-industrialized ancestors. What does that mean? That means that we are spending a lot more time sitting compared to walking and gathering like what was happening a couple 100 to 1,000 years ago. And so there's been research showing that the sheer fact of being inactive is a more significant risk factor to being in pain rather than just being overweight itself. And so what does being active truly mean? It doesn't necessarily mean that you have to go to the gym and give it a 10 out of 10 effort every single time. In fact, a simple walk multiple times a day would be sufficient. The CDC actually recommends 150 minutes of moderate activity per week, and it's a cumulative amount. So you can split that time up over a span of days and also throughout the day. So for me personally, I like to get up every hour to stretch my legs out if I'm spending my days sitting down. I get a little antsy, but I notice that once I get up and move my legs around, I'm feeling a lot better. Now, not only is getting movement into your day important, but the quality of your motion matters as well. And so I like to think our bodies as cars. If we continually drive it into the curb, of course we're going to experience some damage. But if we can avoid the curbs as much as we can, we really minimize the risk of putting ourselves in compromised positions. So again, moving responsibly, moving with quality. So what that means is that it's prudent that we move, again, responsibly and make sure that we're maximizing our efficiency and movement quality. And you can do this through a couple of different ways. The first option is actually trying to do all of this on your own, trying to fix your pain on your own. And so here are the main movement principles that I recommend if you plan on actually trying to fix this problem yourself. Number one, a little bit of motion is better than no motion at all. Are you able to tolerate only a minute of walking or standing before you have to rest? That's totally fine. See if you can actually sprinkle that throughout the day. So it's like multiple bouts of that 1 minute. Two, you really do not need to push your limits. Every time you try to push past that pain point, it's like picking a scab. And the more that you pick a scab, the slower you're going to heal. It's bloody, it's a mess, it's not comfortable. On the other hand, number three is it is important to explore your limits, but see where they are. If you notice a slight increase in your capacity or your movement, then that's a sign of improvement, and it gives you a little more permission to be able to test the waters a little bit more. But one of the things I find to be really, really important is that you need to take an inventory of the pain that you're feeling, not just whether or not you are having pain, but you have to ask yourselves these questions. Are you experiencing centralization of pain, or are you experiencing peripheralization, aka is your pain becoming more local to your spine, or is it spreading down your leg? And then the fifth point is the fact that I recommend that you approach your pain like a detective. You want to search for clues that may help you figure out what you can do to recover. You can also work with a professional such as a physical therapist, chiropractor, acupuncturist, or someone like me. The key to success when you're working with a professional is that you need to be as detailed as possible when sharing your experience. The other day I was actually working with a client. I asked how they were feeling and they replied terrible and nothing else. They just said, I feel terrible. And so I So because of that, I couldn't really do much with that information. So then I had to dig a little bit deeper to get them to describe what was happening. From there, I had the necessary information to help them. And the key is the more you share with your professional, the better. And so there are many benefits and health benefits to losing weight, specifically fat. However, if your primary goal of losing weight is to break free from your sciatica pain, remember that losing weight will actually take time and it won't guarantee that you'll have less pain. The research has supported that. And although there can be some very specific qualities that may improve with weight loss as well. So just some things to consider. So here we are at the start of the new year. If you have a question or concern that you would like to hear more about in the future in regards to emails, podcasts, or blog posts, submit your questions and topics over to me at info@ifixyoursciatica.com. It's going to be a great year. Thank you so much for tuning in. We hope you got some help from today's podcast. And for more info, check us out at ifixyoursciatica.com. Have a fantastic and pain-free day. No patient-therapist relationship is formed by listening to this podcast. We are not providing medical advice, and all information should be confirmed by a medical provider.